In the last few years, we have observed increasing numbers of trials evaluating neoadjuvant immunotherapy in dMMR MSI colorectal cancer. Most of these trials were phase 2 single-arm trials, so we do not still have results of big randomized trial, but the results we had are absolutely promising in terms of PCR, pathological complete response, and disease-free survival. So the biggest questions was about applicability of this regimen in a large scale and in a real-world setting, and how to manage the treatment choice, the toxicity, and the risk of over-treatment of especially colon cancer patients. So what we had done was a real-world study. It was called AGEO-NEO-MSI study that's evaluating neoadjuvant immunotherapy in dMMR MSI colorectal cancer with no distant metastasis and who were treated with neoadjuvant immunotherapy. So we have enrolled 316 patients, so it's the largest cohort today available. And patient included had a median age of 68 years old and were mostly stage 3 disease in 75% of the case. Patients were treated with single ICI in 77% of the cases and doublet ICI in 23% of the cases, and the primary endpoint was complete response that was defined as pathological complete response or clinical complete response if patients were undergoing to non-operative management. So what we saw was that complete response rate in the overall population was 67%, and pathological response, complete response in patients who were operated was 66%. So these results are in line with the available literature, and these results confirm the applicability and the feasibility and the great results of this strategy. What we also saw was that event-free survival, despite an immature follow-up of 16 months as a median follow-up, was not 100% which is what we have seen in different trials, but at 2 years we are at 86% of event-free survival patients. Regarding toxicity, we show in our cohort 35% of immune-related adverse events of any grade, including 6% of grade equal or more than 3, 9% of toxicity-related discontinuation, and 1 toxic death. And the severe toxicity were more frequent in patients receiving doublet ICI. So we can say that our study confirmed the great efficacy of this regimen. Doublet ICI seem to be associated with a higher rate of complete response, but also of toxicity. So we need to better understand how to manage this treatment, how to perform patient selection, and we have some translational analyses that are ongoing that we hope can help us in this sense.